right. I think we're ready to go, are we not? Welcome, bienvenido. Thank you very much for coming. I'm delighted that we have this really great full house of people. I know most of you, those of you I don't know, I look forward to catching up with afterwards because I will hang out for a little bit. My name is Dr. Stephen Forsaw. I'm the director of the LGBT Health and Policy and Practice program here at GW. You probably know this is a fundraiser for our event. We try to raise money for scholarships for our students. We're sponsoring this event. This is the first thing we've been able to do in 2.5 years. This is absolutely incredible. Our program is, we're now enrolling, we're absolutely thrilled to be enrolling our 10th cohort of students. Yeah, no kidding. It's amazing. And our mission is to train healthcare providers to do better providing care for LGBTQIA plus patients. Better outcomes and better quality of care and better experience through healthcare. And that's what we've been doing for a long, long time. So I want to remind everyone that tomorrow is officially Giving Day at GW. Those of you who don't know, so no better excuse than to whip out that credit card, and I'll mention that again later. Many of you donated, and I want to thank those of you who donated coming in the door. Those of you who haven't, I would certainly appreciate your doing so before you leave. But our speaker tonight, with all the events that are unfolding in Texas and Florida and all these other places, and it just seems like a daily barrage of really bad news for trans people, now could not be a more important time to be doing what we're doing and have the kind of speaker we're having talk to us now tonight in Cecilia. I want to get right down to business, but first I need to thank several people. First and foremost, Andrew Moss, who is sitting right here. He's going to be really shy, I'm sure, but just maybe not so shy. Raise your hand. Almost a year ago, he came and he said, "I got this idea." He was like, "Great idea!" And this is here we are. A few false starts after COVID. Yes, COVID. No, do we go or do we not? This one looked like the right one. Omicron was dying, and here we are, and I couldn't be happier. So Andrew, thank you so much for bringing this to me in the throes of COVID, and Cecilia too for coming to be our speaker. Joe Kennedy, of course, for coming as well, and you'll hear from all of these folks in just a little bit. I need to thank Nancy Esparza over in the corner. So Nancy is she's our program coordinator, and she does all the hard work, and the rest of us take the credit. That's how that rolls. We have two wonderful interns, Paige and Layla, who are both here tonight. You've seen them along around. Yes, thank you. As well as an army of volunteers who are, some of them got the blue shirts on, or some of them are dressed in different ways, but they're taking care of the food, they're taking care of the wine and the beer and all that sort of thing. So I do want to thank them. We have current program students. Anna is here. I know Anna is here in person. Yes, say hi. Current program student. We've got several online. I know that because our program is cross country and actually global. So we have one student now in England, but some students are online, so not all of them are going to be here in person. And I want to thank our faculty too. Kat Carrick is here. Again, just raise your hand. Okay. Dr. Carrick has been with us since year 2. And her expertise is in rural health and lesbian health. And she is one of our, she now is taking over the capstone course and is really the best den mother you can have when it comes to shepherding projects from beginning to end. And there's some amazing projects. And Dan Daly, too, here is our consultant on our capstone work and is a program management expert, project management expert, excuse me. He actually works at NASA, so he is kind enough to come down here and make sure we, do as well as NASA does, making sure people get the space and back in a safe manner. But supremely, I want to thank our alumni, and we've got quite a few in the house now. Adam, I saw you just walk in the door. Where are you? There you are. So coming from our very, very first year. So Adam is from our 2015 graduating class, our second graduating class. I know we've got Ron Schlittler, who is from our first graduating class over there. Who else do we have in that? Max. Where you at? Okay, raise your hand. A couple of years ago, from a few years ago, who did an amazing capstone project. All here to support, and they will tell you how important this program is to the community, to the overall environment, and how important it is to sort of support their scholarship. We also have our organizational sponsors. So we've got Allied and Pride. We've got some volunteers from Allied and Pride here. Raise your hands if you're Allied and Pride volunteer. Yes. Oh, they're all in the back. come up and mix like you should. We've got some. Yes. Thank you. We have a couple of Cisneros students as well around. Were you in the same group, sort of? Okay, there you are. Okay. Yeah, there you are. There you are. And also the LGBTQI2A+ Resource Center group is here tonight. And I think there's a couple of volunteers. There you go. Thank you. Yes, indeed. There's AJ. Appreciate that. I also want to thank Jamie Branda and Bot and Floriana Restaurants. So if you, all right, I live on 17th Street, and this is why this happened. 17th Street has got this long strip of restaurants, and Jamie Branda has owned Floriana for a number of years. It's his restaurant on 17th Street. And every single time that I hold an event, I say, Jamie, help me out with just sort of, he writes a check that makes sure we stay in the black every single time. We start out not losing money because of Jamie, and I got to thank him for that. So go visit Floriana. It's a great Italian restaurant, and he's been very, very loyal and very helpful to us, and I want to make sure I thank them properly. And lastly, the GW administration. I'm about to introduce you to our current provost. This program got started with a conversation I had with my now good friend, Steve Lerman, who was the provost in 2011 at this university. And right from the very beginning, this university has been behind us. I went to them and I said, that the Institute of Medicine released this big report on LGBT health in 2011. And I had a conversation with several colleagues, Charlotte Patterson, who was my mentor at UVA, and said, now is the time for something like this. I went to the deans, and I went to Provost Lerman, who said, this is a great idea. He has a gay son, so he said, this is, you need to do this. The deans, right down the line, at the time, they've all since turned over, but our current deans are equally as supportive. I want to thank Dean Walbeck. I want to thank Phil Beck and Chad Heap in the Columbian College for supporting our program, even in the midst of a pretty tough time during COVID. Right on down the line to Provost Bracey, who it's been my pleasure to serve on the committee, this group now, this diversity panel, the diversity review panel that is doing some very, very important work to make sure our university is one of the best and a leader in diversity for everyone. And that's where I'm going to make it as a great segue here to, I want to introduce your the next speaker here is Provost Christopher Allen Bracey. He is an internationally recognized expert teaching and researching in the areas of legal history in US race relations, constitutional law, criminal procedure, civil procedure, and civil rights. Graduate of UNC, University of North Carolina. We've got North Carolina people here in the house, so good for you. And Harvard Law, and Harvard Law School. Previously taught at Northwestern University, where I have some very good colleagues in the School of Law, and Washington University School of Law before he came to GW way back in 2008. And he was previously a senior associate dean, an interim dean at GW Law School. Not that long ago, he became interim provost and was named subsequently as our permanent provost in February. And it's been my absolute honor and pleasure to work with Provost Bracey's team on the diversity review panel that's happening now. So I give you Provost Bracey to introduce our main speaker.
Thank you, Steve, for that wonderful introduction, and welcome to you all. I want to thank you all for coming out on this important evening for this event. The George Washington University is committed to supporting and advancing programming, education, and research that aims to improve the world. The LGBTQ health policy and practice housed within the Columbian College of Arts and Sciences serves this important goal. The program trains current and future health leaders to develop and apply best practices and shape policy to eliminate disparities and improve health outcomes for LGBTQ individuals. It is truly a groundbreaking program. I want to thank all of those people responsible for bringing this program to fruition. When it was founded in 2013, it was the first of its kind in the United States. So this was truly a groundbreaking effort. The program recognizes that improving health outcomes for LGBTQ individuals means enrolling students across disciplinary boundaries, including public health, public policy, mental health, social work, nursing, and medical science, as well as taking an intersectional approach to LGBTQ individual experiences. Cecilia Gentili, a trans Latina activist and actress, will tell us in a moment about her journey as an undocumented immigrant from Argentina and will highlight how important this work truly is. As we discuss the importance of and acknowledge the support of transgender rights in the context of health equality, we must remember that the program's work is not simply valuable, but it is both urgent and critical. I would like to take a moment to recognize Steve, the founder of the program, who's been its shepherd into its 10th year. This program's excellent work has been recognized with numerous awards, including the Gay and Lesbian Medical Association Achievement Award in 2019, and this year's LGBTQ Health Workforce Organizational Award. Steve's dedicated leadership has been a major factor in this program's success over the last decade, along with the expertise of many committed faculty and experts across a number of fields, many of whom are here with us this evening. I would like to also recognize Steve for using his depth of knowledge and experience to participate on the university's diversity program review team, which I announced in February, and will produce a diversity action plan that can be implemented that will further advance the university's diversity, equity, and inclusion efforts. So thank you for that as well, Steve.
Thank you.
Now, it's my great pleasure to introduce former Congressman Joseph Patrick Kennedy III, who served as the United States Representative for the Massachusetts 4th Congressional District from 2013 to 2021. Congressman Kennedy's career has been dedicated to social and economic justice, in particular, proactive activity for the LGBTQ community and LGBTQ rights. He served as chair of the Congressional Transgender Equality Task Force and was active in Congressional LGBTQ Equality Caucus for trans rights. While in Congress, he sponsored legislation supporting transgender rights, including supporting the Transgender Day of Remembrance, which memorializes the lives lost to anti-transgender violence and recognizes the increased violence against transgender Americans, and particularly transgender women of color. Curtailing the use of the panic defenses used to excuse violent crimes against trans people by blaming the victim's sexuality or sexual orientation or gender identity. The Do No Harm Act, which would ensure that religious liberty can no longer be used to discriminate based upon race, gender identity, or sexual orientation. And challenging President Trump's ban on transgender people serving in the military. Recently, he founded a groundwork project which supports community-level activists and organizers working to represent the underrepresented and works for more representation within the political system, which should be working for all people. Please welcome to the podium, Congressman Kennedy.
Here all night, my gosh. Thank you so much for the extraordinary introduction, Mr. Provost. Thank you for the invitation to join all of you this evening. Thank you for having this event. And I am so grateful to be able to be here to gather with all of you to celebrate this work, to celebrate activists and our heroes like Cecilia, and to be able to be together here in the midst of a challenging time for those of us that recognize trans rights as human rights, but to find comfort and faith and force in each other. So thank you. I want to start as well with a couple of acknowledgements. First off, Provost Bracey, thank you for the incredibly kind introduction. I know you've got a number of other events to get to. We were chatting before. In a prior life, I would be back to back to back to back, and had the wonderful experience of pulling out a set of remarks and reading them to the wrong group. So well done. I got that one right. Good work. But thank you for your leadership of this extraordinary institution, for your own contributions to the field of law, and for some of the most pressing issues of our time. So grateful to be here with you this evening. Steve, well done. To be able to see and identify a need, and to fill that need with a vision, and to be relentless in the crafting and sculpting of that vision, but to be as inclusive as you have been, and pioneering yet humble, brilliant and determined, to be able to see how that has grown and filled this gap is extraordinary. And we are grateful for your leadership, your activism, and for all you've done to make this evening possible. So thank you very, very much. Perhaps most importantly from my perspective, is my cousin and goddaughter is actually a GU student, and she was right back over there, and now she's hiding. Isabel Rouch right back there. I see you. Thanks for having me. We caught up for coffee. Good to see you. Thanks for showing me around campus. I'll tell your mom you're doing good. We're all good. So everybody, it is an extraordinary honor for me to be able to address the LGBT Health Policy Practice Program, one of the most innovative pro-equality academic curriculums in the country. To all of the participants that are both in person and virtual today, that you've chosen to do this work, to deepen your own ability to meet patients, clients where they are, to help build a healthcare system that is compassionate, responsive, and accessible. Far too often we forget that last part, but accessible to all. A deep and sincere thank you. As some of you know, now all of you know, thanks to Provost, I had the privilege of serving as chair of the Congress's very first Transgender Equality Task Force back when I was in office. And it was an incredible honor for me to be able to try to center and lift up those voices and to center these issues in trans rights as human rights. But it may also have been the only job that I've had where I said publicly and proudly from day one that it would be a great day when someone takes this job away from me. Not because I didn't love that work, not because I wasn't wholly committed to it, but because it is a job and we are in a time that should be held by a member of the trans community. There's no doubt that we are well past due to have trans representation in Congress. And I do believe that thanks to efforts and advocacy of many of us spread out across this country, including many of you in this room, that we can be on the cusp of that. And I believe, thanks to that fearless advocacy, and in particular, the special guests that I get to introduce, that this country will find itself electing first trans congressperson in the not too distant future. And we do that despite the hate. We do it despite the indescribably horrific events and efforts that we've seen from conservatives across this country to deny the safety, the health, the humanity of the LGBTQ plus American community. And sometimes, indescribably, children most of all. I know in this moment, it can be easy to feel dejected, be heartbroken, to feel like our country is regressing on matters of equality before our very eyes, particularly when it comes to our transgender neighbors. And I urge you to let yourself feel all of those things, to sit with them, to create that space. And then do whatever it takes to turn those feelings of fear and loss into fuel. Fuel to fight back. Fuel to take a righteous stand in your own life, our collective experience, for a country that accepts you for exactly who you are. Nothing more, nothing less. Fuel. To show the haters, the tormentors, the bullies, the bigots, that in this country, equality and freedom are not values to be compromised. The woman that I have the profound honor of introducing knows a thing or two about that fuel. Cecilia Gentili is our keynote speaker. An activist, an advocate, an actress, and an entrepreneur. And that is quite a line to utter. Whose work and life story embodies the grit, the resilience, the triumph our country badly needs at this moment. Originally from Argentina, Cecilia came to the United States for a safer life as a transgender woman. She lived in our country for 10 years, undocumented. Her harrowing experience surviving this time in her life fueled her desire to ensure that anyone and everyone living on the margins are provided with access to dignity and respect, protection, and progress. Cecilia started her consulting firm, Trans Equity Consulting, in 2019, with the mission of developing LGBTQ affirming services, establishing genuine equity in the workplace, and shepherding new generations of change for all. She previously served as Director of Policy at GMHC, the world's first and leading provider of HIV/AIDS prevention, care, and advocacy from 2016 to 2019. Her success in policy has also inspired her to found Decrim New York, a coalition working towards the decriminalization, decarceration, destigmatization of people in the sex trade. Cecilia was instrumental in the development of 2 statewide bills to provide survivors of trafficking with record relief and to end the criminalization of loitering, a charge that overwhelmingly was leveled against transgender women, regardless of their involvement in the sex trade. Throughout her extraordinary career, Cecilia has trained more than 3,000 individuals on a range of issues that include LGBTQ inclusion, immigration, drug use, sexual health, trans sensitivity, and intersectionality. She has worked from governments to major corporations to bring about lasting change. Cecilia is an op-ed contributor to the New York Times, a recipient of the 2020 Community Leadership Award from the Brooklyn Community Pride Center, and the recipient of the 2021 Leadership and Advocacy Award from the Association of Community Affiliated Plans. And I'm not done, folks. That's not enough. She's an actress. She's featured in 3 seasons of FX's network in the groundbreaking Emmy and PDP award-winning show Pose, as in the unforgettable role of Miss Orlando. So tonight, we have the privilege to hear from Cecilia about her incredible journey. She's a role model and a hero for transgender people everywhere, for all of us. It's my honor to be able to introduce, to give a shout out and a hug and a huge thank you and an amazing, oh my gosh, to Cecilia. Thank you. Thank you.
Wow, that was really nice. Thank you so much. this is like really incredible, right? Me being at George Washington University giving a speech, right? If you think like 10 years ago, I was coming out of jail. I was coming out of immigration detention. I had a very, very severe addiction to heroin and all kinds of other drugs. And I was homeless, and I didn't see a future for myself. So I think those are very, very nice 10 years that went by, right? That had me here talking to all of you. And that's pretty amazing, right? I don't want to come across as defining success, because success is different for everybody, and we all have different ideas of what success look like. In my idea of success, I'm pretty successful. And yes. But I just want to make sure that, I'm not defining success, because that, we all have different ideas of success. So the important thing is that whatever we see success as, we all have an opportunity to achieve it, right? So whatever success look like for you, is the important thing is that we all get an opportunity, right? And I was given so many opportunities, and I'm so grateful for those opportunities given to me by allies. I think like the word ally has been overused lately, and it's a little bit like washed up. But I really think that we all here in this room are true allies, and we are doing everything in our power to make the realities of people like me a better reality. And when I talk about people like me, I talk about a trans person, I talk about an immigrant, I talk about an undocumented person, I talk about sex worker, I talk about a drug user, I talk about a person with mental health issues, I talk about a person who survived physical and sexual violence and is still here and still needs the support to shine and achieve whatever success look like for her. So thank you all for being here, because you all are part of that opportunity to succeed. And I am taking full advantage of all of it, honey. So, very interestingly, my speech has disappeared, and that's great, because that's what I do. I tap dance around, right? And I swear I did write a speech, but I think it's a great opportunity for me to talk from the heart, right? And to talk about experience, because that's all I have. That's what I made my career from, right? I decided that yes, people can learn about trans people in school, but nobody knows about my experience than myself, right? People can learn about sex workers in school, but nobody knows better than sex work than myself, right? People can learn about drug users in school, but nobody knows better than using drugs than myself, right? So as I said before, I had a wonderful opportunity to put all those things together that usually put you in the, down and at the bottom of the barrel, and make not only my living, but also create a company where I employ 10 other people who are trans people, who are sex workers, who are drug users or former drug users, and we all are creating the future that we want for ourselves. So I'm very proud of that. I'm very proud of that. Am I too loud? A little bit. It's not the first, just be honest. It's okay. It's not the first time that I hear that. I wanted to talk to all of you a little bit about my experience, right? I love, as I was talking with many of you, I love the smell of magnolias. And DC is so special, because next thing you know, you're walking on the street and the smell of magnolias just hit you, and it's so beautiful, and I love it. And I also love tangerines because the smell of tangerines is so beautiful and tangerines are so delicious. And as a child, I used to live in trees. I just climb every tree that I can, mostly the magnolia tree, which is sad because you can't cut a magnolia flower. When you cut it, it goes bad right away. You have to admire them in the tree, right? You have to smell them in the tree. So I would be climbing magnolia trees and I would be climbing tangerine trees all the time. And I believe I was 3.5 years old. And my mom, tired of me peeing myself at night after eating so many tangerines, went with a stick, right? And she was like, little boy, come down, little boy, come down. And I looked down at her and I said, no. And she said, little boy, come down, little boy, come down. And I looked down at her and I said, no. So she looked at me and she said, you're not gonna come down? I said, no, I'm not a boy. And I was 3.5 years old. I wish I could tell this to freaking Governor DeSantis, right? Right, that is the exact time where most of people that I know of trans experience start getting a sense of who they are in terms of gender. That is the most important time in which a person needs support. That is the most important time that a person needs people around them who understand them and let them be themselves, right? So in my case, it was the 70s. This is the part where you all can't believe that I was born in the 70s, okay? So I'm gonna go again. So in my case, it was the 70s. I know. I always get the same natural reaction from people. Is the Argentinian gene. Yes, right? Yes, Latinx genes. Hello. So it was Argentina in the middle of the 70s. We were about to get into one of the most terrible dictatorships that my country experienced. It was hard. It was really hard. It was no internet. It was no exposure to anything that was different than cis, straight mentality. So for many years, I didn't know anybody like me. When I was 5.5 years old, I was kicked out of the girls' bathroom and I could not understand for the life of me why, right? One day I got to school, and when I got to school, they said like, no, don't go to class. You have to go to the principal's office. And you know, you're 5 years old, but you know, if you have to go to the principal's office, some shit went down, right? So I went to the principal's office and there goes the principal, my mom, my teacher, 2 women on the side. One was a psychiatrist and the other one was a psychologist. I didn't know anything. I was so scared. And they look at me and they are like, you've been using the girls' bathroom. And I said, yeah. So remember those maps that you used to push down and they would go down? I don't know, am I aging myself here? Sorry, millennials. It used to be maps that you pull down like this, and you get to see a map in an actual paper. It's a thing. It still exists. So they pull down 2 maps, and before in front of each map, they put a drawing of a penis and a drawing of a vagina. Nowadays, you can't do that kind of crap. You know, you cannot that. But it was the 70s, and whoever lived the 70s, you know, everything happened there, right? So they pull it down and they ask me, what do you have? Right? And I look at one, and I look at the other one. And you know, you go back like if it's gonna change. And I said, I think I have this one. And they're like, correct. That is a penis. And who has penises? I'm like, me? And they're like, no, only you, but all boys have penises. And because you have a penis, you're a boy. And I just couldn't believe it, right? I was like, that's not how I feel, right? But I guess that was the first time that I decided that I was gonna negotiate with life and with the rest of the people, right? And I said, okay, you want me to go to the boys' bathroom? I'll go to the boys' bathroom. Sometimes I had some fun in boys' bathroom, I have to say. But at the moment, I could not understand what they were talking about, right? I am from an area of Argentina where it was very known in the 70s for UFO activities. So my brother, horrible brother, one time we were driving to my grandma's house and my brother just elbowed me while we were crossing a railroad. And he said, did you see that railroad? And I said, why are we whispering? He said, I want to know. We found you on that railroad. I was like, what? And he said, yes, you know, you are not my family. We found you there. Terrible brother. He's still the same. He still makes me cry all the time. And I believe him, you know, he was my big brother. So when we got to my grandma's house, I ran to her and I said, Grandma, I know everything. And my grandma was like, okay, what do you know? I said, it all makes sense now. I am an extraterrestrial and I was left here by mistake in the railroad. But I belong to a planet where all the girls have peepees like me. And my grandmother, being that amazing woman that she was, looked at me and said, that makes sense, most likely. Most likely, yes, totally, I totally get it. You may have a point there, but what do you want to do with that? And I said, I want to go to my people. And she said, but I'm going to be very sad if you're not here anymore. And I said, but Grandma, I'm going to be happy with people like me. And she said, I understand. So that night, we took chairs outside and she made cookies. And we sat there and we waited and waited and waited. And nobody came around. And around 1 a.m., she said, you know, extraterrestrials are very busy going through the whole galaxy, you know. Maybe they don't have time to come tonight. Maybe they will let you know. But, you know, for today, I think it's time to go back inside. And I want you to know that I am your family. And, you know, Mom and Dad may not get it, but I get it. I get it. And I'm here to support you and I'm here to work around whatever you need, right? And that's when I start using all her jewelry, you know? But how important, what I'm trying to say here is that we live under this understanding that progress has happened throughout all these 50 years from the 70s. But at the same time, in this country, the country that I came to live, looking for a better future, the same crap is happening to children in Florida or to children in Texas, right? Where they are going to have to hide who they are in fear of being ridiculed, in fear of being taken away from their families. parents are not going to be able to be supportive of those children because they will have cases with child services, right? And overall, people are going to have a much more difficult quality of life. And that is the moment. And my grandmother was the only person who was supportive around me. But my life is different because of her, right? So I believe that every child should have that kind of support. And as I said before, I started at 3.5. That is the most important time of developing gender. Around 10, 12 is when folks start developing a sense of sexual identity. We all need that kind of support. We all need that support that make us feel like we belong, right? And that we are not the only ones. I believe that I was an extraterrestrial for 17 years. Yes, I never met another trans person. When I was 12, I met a gay boy. And I thought, this is not really how I feel, but it's close to it. So I started saying that I was gay. My mom had a heart attack. Yes. And when I was 17, I left the little city that I was from and I moved to the big city to go to school. And I knew that in the big city, someone was out there that was like me. And I went looking for them and I found her. She was this amazing, statuesque, blonde, curvy, trans woman. And I ran to her and I said, oh my God, I'm like you, I'm like you, I'm like you, I'm like you, I'm like you. Please help me, help me, help me. I want boobs. How do I get boobs? Please, can I get boobs? And she was like, oh my God, so annoying. She said, I'm working right now. I cannot help you, but if you come later, we can talk. And that's what I did. I waited for her, and around 6 in the morning, I went back to her, and she took me for coffee, and we talked about it, and she told me about hormones, and she told me about surgeries, and she told me about my terrible sense of fashion, which has improved, right? And it was amazing. It was the most wonderful thing that ever happened to me. Imagine that you live 17 years thinking that nobody else is like you. Finding that, it was the most amazing thing that I could remember in my life. Finding that someone else was like me. Of course, at the time, it was no opportunity to get any medical care. We were each other's medical care, right? We were giving hormones. We were taking care of each other when we were sick. We were putting silicone in our bodies. And, it may end up being such a terrible thing, but at the same time, that was the only thing that was at hand for us, right? Having hips was life-saving because maybe because of my hips, somebody wouldn't read me in the street and somebody wouldn't kill me in the street. So you know what? Yes, I put silicone in my body. That's what it is. It was not the smartest thing to do, but it's there. And all I need is a doctor that doesn't shame me for it. I need a doctor that knows how to treat me. I need a doctor that understands what silicone is and needs a doctor that treats me like a normal person who happen to have freaking silicone in their body, right? Am I asking for too much? So when I met this woman, she told me it's 3 things that you need to know. You're gonna be a whore, you're gonna get high, and you're gonna die young. At the moment, I thought that I was gonna defy all those things and that I wouldn't do any of them, right? Soon after, when I started, my body started changing, my presentation started changing, I was not able to go to school anymore. I did not get an opportunity to continue going to school anymore because I didn't get to school anymore and because my body was changing, because because my appearances was changing. My father didn't support me anymore with money. And I tried to look for jobs. And guess what? I got no jobs. Nobody would hire a person like me. So sex work came naturally. It was a normal thing, right? Everybody was doing it around me. I couldn't get a job. All these dudes were trying to have sex with me, and I needed to pay rent. And when I tried to pay rent with their love, they didn't take the love, they wanted money. So I said, you know what? This is what I have to do. And that's how I started doing sex work. And I was a very successful sex worker for many years. And I navigated life and I survived thanks to sex work for many, many years. Also, as a sex worker, drugs were part of it, right? I could not escape it, right? And you may ask, why sex workers use drugs, right? Many of us like it, right? Many of us have to do it because clients will not see us if we don't get high with them. Many of us need to stay awake, right? And for many of us, it's just around it. It's just so easy. It comes with the territory, right? So I ended up using drugs for many, many years. And it's one thing that didn't happen. I didn't die young. I just turned 50 years old, and I have plans to be able to. But it was pretty much what I expected from life, right? And I lived all my life thinking that that was going to be my fate, and that's how life was going to go, right? So for that, I want you all, for those that are medical providers here or that have some kind of interactions with trans people, I want you all to think about trans people and their relationship to risk, right? Our relationship with risk is different, right? Me, as a trans person, as a sex worker, as an undocumented immigrant in this country, as a person who used drugs, I made decisions with an idea of risk that may be different than yours, right? Many times and so often, medical providers and service providers kind of use their idea of risk as the golden rule. And if something that I want you all to walk away with is with the idea that risk is different for everybody. My idea, knowing that I may not have it tomorrow, who cares? Yes, put silicone on me, right? It's fine. I may die tomorrow, right? Yes, let me have another bag of dope. Who cares? I made that to somebody may kill me tomorrow, right? The idea that risk is different for everybody will help us provide services with less shaming and with less understanding of what's best for people, because what's best for people is decided by people, right? We all know what's best for us, right? So I knew what was best for me for many years, and that's what I did. So I invite you all to kind of redefine what risk look like for the people that you serve, and to be open to the decisions that these folks make for themselves and to respect them. You may not like them, but they're not your decisions to make. They're the decisions that these folks made for themselves. And a good provider may give you good feedback and may tell you, I don't think that's the best thing to do, but I respect it, right? I had to have like 650 trans patients where I was working at Apicha, a health center where we did healthcare for trans people. And many times I had to say, like, I don't agree with that decision, but I'm gonna respect it. I'm gonna tell you why I don't agree with it, but it's your decision. It's not mine to make. And you can still come here and you will still get the same things if you make the decisions that you make. You don't have to follow mine. So that's the most important thing that I want you all to know, right? So as I said, I'm 50. and I'm still here, and that is a beautiful thing, right? But many of my friends didn't make it. Many of my friends are not here. A couple of days ago was the second anniversary of the death of my dear friend and mentor, Lorena Borjas. Lorena Borjas was this trans woman, sex worker, drug user that I met in Jackson Heights, working in the streets. Lorena Borjas was this woman when condoms were used as evidence to lock up sex workers. She would walk Jackson Avenue up and down, making sure the sex workers always had 2 condoms, but never 3, but they will always have 2. So if the police would come, they would have only 2 and they couldn't arrest them. And she would do that all night long and ask me who was paying her. Nobody. She was making no money. That is the kind of commitment that only comes from loving your community, from knowing what it is to live that life. And she did that, right? Lorena, 2 years ago, called me. We had a meeting. I was trying to teach her how to use emails, right? Because, you know how to use emails now. I said, you can't just keep sending notes to people in paper, you know? Millennials don't answer the phone. You have to send them an email, right? And it feels like I have a bone to pick with millennials. Sometimes I do. She called me and she said, I can't go to see you. And I said, what, Lorena? I cook for you. And she said, I don't feel well. And she started coughing. And I said, Lorena, you know there is a virus out there that mostly affect your lungs and mostly make you cough. And she said, yeah, but I'm fine. I'm like, have you had fever? She said, yes, for 4 days already. And I'm like, you're gonna go to the doctor? And she said, no, sis, I don't go to the doctor. Right? Lorena went through so many terrible experiences with medical providers that she chose not to see a doctor. She chose not to go to the hospital. She chose to stay at home with 102, 103 fever because it was better than going to a place where she was going to be humiliated. So when we said that trans people put care to wait because they don't want to encounter medical providers that are transphobic, it is a reality. This woman, this leader in the community, this person who was working all the time for the community chose not to go to the doctor. I called an ambulance and I sent it there and I said, you all have to take her. Right? And that's how she ended up in the hospital. When she was in the hospital, she would send me pictures of papers and she would say, what does this say, Cecilia? Because the place was not giving her any interpretation. Mind you, it was a pandemic, everybody was super busy, right? But it was no interpretation, it was no papers in Spanish that she could read, right? She also told me that she didn't understand the doctor, right? We don't know what would have happened if she went to the doctor when she started having symptoms, but I like to think that she'll be with us, right? So for that, it's so important the work that you all are doing, right? I think it's so important that you all are taking the time to learn about trans lives, that you're taking the time to learn about trans people, because when we have providers that understand us, that understand our body, that understand who we are, that understand the decisions that we make, you are making a real difference in the world, right? And you all are advocating for those changes that need to happen. You know, trans people, you know, statistics says that, you know, most of us don't go to see medical providers. Some of us don't even have the money to do that, right? That was my case many times. You know, I was an undocumented person. I didn't have health insurance. I didn't know how much it was going to be. So I didn't go to the doctor, right? So making sure the healthcare is accessible is paramount. Many people in this country, the leader in the world, do not go to see medical providers because they can't afford it, right? Trans people don't go to the doctor because they're afraid that they're going to be discriminated, right? And then happens what happened to Lorena. I don't go to the doctor. If I get sick tonight, I don't go to the doctor in DC because I don't know who is going to treat me. I don't know if it's going to be like happen in New York City in a very, very important hospital. I'm not going to say the name, but it's on Wyckoff Avenue. I went to see a doctor there, and you know, this woman, the triage nurse, we had a long, about 15 minutes conversation. There was a lot of people around me, and she was asking for my period. And I said, I don't have it. So then she looked at me and she said, oh, you're 50, I understand. But when you had it before, when was the last time? And I said, no, I don't have it. And then she went a little bit deeper and she said, el periodo, tú no entiendes inglés. ¿Cuándo tu periodo? And I said, girl, I've been talking to you in English for 20 minutes. I pretty much understand what you're saying. And then she started making gestures. She was like, el periodo. When did you bleed? You bled. When? And I said, I get it. It was last week. So she said, see, it was so easy. And I said, like, yeah, let me tell you, I was shaving my balls and I cut myself. And it bled like a motherfucker. So she was surprised. And I said, yes, some women like me have testicles and that's okay, darling. But I have to say, I was talking with somebody in the room and I was just like, I had a lot of compassion for her because I thought this woman is working, is overworked, most likely underpaid, went to school, paying a lot of money for it, and nobody taught her about this kind of woman. And the hospital that I'm gonna have to pay $250 copay for this humiliation is not offering her a training to talk about this kind of woman. So I do have a lot of compassion for her, but it's hard. When these things happen and happen and happen to you, it makes sense that many of us don't go to see a medical provider. I don't know, how am I doing with time? Is it 9 p.m. already? Am I good?
Yes, you're good.
Yes, too late.
We got a little more time.
We have a little more
We'll do
time.
a little Q&A in about 5 minutes.
Okay, so well, that's all I have actually. So thank you for being here. I really appreciate you all.
I'll do some Q&A. There's a mic.
I swear I had it. Do you know where my speech went? It was here. Somebody can read it. It was, I swear, it didn't have any profanity. Oh, no, it was much, it was like 10 pages, I swear. Yeah, I think that's my speech.
Is this it?
This is my speech.
Okay,
See, I wrote the whole thing. I'll send it via email to all the millennials. Questions?
Hi, yes, my name is Lisa Jones. I'm a reentry coordinator for HIPS. And I'm sorry for my tardiness, but there's been some situations going on. However, I would like to know, how can we at HIPS correlate with you where you are, and that we can empower transgenders that's coming out of prison, out of jail, out of homelessness. And my biggest thing is empowerment. And I'd like to strengthen our people so that we can value our worth and therefore stand on a platform that can commit us to a better tomorrow.
First of all, thank you so much for your work, because I know very well of the work that you all do, and that's the work that nobody else wants to do, right? Nobody wants to work with the host. Nobody wants to work with the folks that shoot, heroin. Nobody wants somebody that didn't sleep last night and is having a crisis, and you all are doing that work. Thank you for
I
that.
am actually I have lived homeless. I've slept on cardboard boxes. I have been on corners when there was nowhere to go in the cold and warming weather. And I've come forward through people before me that have opened ways. And I would just like to know how best can we help those that's coming behind us, because there's so many homeless and incarcerated transgenders that don't even know our rights, they don't even know our way, and I want to shine the light at the end of the tunnel for them. And I'm honored to be here with you. Thank you.
Thank you for all that work. And yes, thank you to all those that were, doing the work before us. I don't know you, but I gather I'm much younger than you. Shade, absolute shade. But what I'm gonna say is that, I am already in touch with you all. We're gonna get together, we're gonna work together. Whatever you need from me, I'm here. But this is what I'm gonna say. The fact that you were homeless, that you lived in the cardboard, it makes you an expert, right? So I want you to start selling yourself as an expert of what you know. Because all these folks may read in a book about it, but you know what it is. You know how it feels about it. And that should be paid. And that should be your job. And that should be how you make money, and you make up for all those nights that you sleep in the cardboard. So you are an expert, my sister. You are an expert of your own experience, and you have to make it work for you. So I love it. I started going to the LGBT center when I was in treatment, and I did treatment, sleeping and showering with men for almost 2 years. It was no guidance for trans people in recovery services. And they sent me to the LGBT center when I met another trans person. And I was like, what are you doing here? And she said, I work here. And I said, what? And I'm like, this woman is not a hoe? She's working in services? And she says, yeah, I am a counselor here, right? I am an expert on trans people. And I said, did you go to school? And she said, no, I am an expert of trans people because I'm a trans person and nobody can tell me shit, you know? So what you know and your experience is unique and everybody needs to hear from you. And I love that you are here. And like these folks at the LGBT Center, they helped me create my first resume that I got my first job at Apicha, and it was all lies, but that's fine, right? I swear, they, you know, like the person that was helping me said like, you know, so what's your experience? I'm like, well, I've been a sex worker all my life. She's like, okay, entertainment. And she's like, what did you do? Well, I used to see clients every day, very good in client relationships. I like, so how was the experience? Are people who call me and they will come? Excellent at making appointments and managing a schedule. So we wrote this whole resume out of my experience, and I went to Apicha and they gave me a job.
It's real.
They gave me an opportunity, right? And I remember the first time my boss said, like, you know, he called me, and at the beginning I was doing HIV work. And he said, I'm gonna give you, you're gonna have 44 clients, but I'm gonna start with 22, so you can take it easy. I'm like, 22 clients. So he said, here is the list, put it in an Excel sheet and send it to me. And I was like, what is an Excel sheet, right? But somebody was there. Somebody found me crying in the corner and said, what's going on, girl? And I'm like, they want me to do an Excel sheet. I don't know what that is. So he was like, come with me. And he helped me create an Excel sheet, right? And that's where I talk about opportunity. You know, I am here because of those opportunities, right? Because people invested in me. So we did the Excel sheet. Then he had to spend a couple of minutes more explaining how to attach it to an email because I didn't know how to do that. And I sent my first email, and the email says, this is the sheet that you asked me for. The thing is that in Spanish, sheet sounds S-H-I-T. So my first email to my boss was, this is the shit that you asked me for. Big meeting to talk about the way on how we communicate in this organization. But they kept me there, and like 3 months after, I was running a whole program for trans people. And a couple of years after, I was the director of policy at GMAC, and I never had policy experience, right? And the second day they said, don't come to work. We have a trip for you to DC, to Washington, DC. And I went and sat with politicians and explained to them why trans people needed money invested, right? But somebody invested on me and somebody gave me an opportunity. So this is what we all need. We are not gonna get anywhere if we don't get opportunities.
Hi. I'm Jose Gutierrez, and I'm working archiving the history of the Latinx LGBTQ community. And I just want to say thank you for being here. Congratulations, and thank you to Steve and all the students, because I think this program, this presentation, is extremely important for the university, but for our community. Is coming together both communities. So gracias, muchas gracias de todo corazón. Gracias por el trabajo que haces. I'm very proud of you and all the contributions to our community. Thank you.
Thank you. I love my community, and my Latinx identity is like so important to me. And I know that not everything is peaches. The Latinx community has a lot of machismo and a lot of like ideas of womanhood, of how womanhood should be, and I wrestle with my, with my own community at times that try to dictate how my life should be, right? And my own sister sometimes she make my life, you know, hard. Lorena, this very good friend of mine, every time I tell her that I was a lesbian, she'd be like, oh, no. But I love doing it to her. You know, many of us have like so many shortcomings of understanding how the life of a trans woman should be, right? And the life of this trans woman is gonna be only dictated by this trans woman, right? I'm not gonna do anything as anybody tell me to do if I don't feel like that's the way. So I'm glad I don't have to explain to her that I'm pansexual now, because that would be much more difficult for her.
Okay, I will stay. I recognize I'm quite short. But first of all, it's quite an honor to be able to address you. So thank you so much for coming today to talk. And for people who have done so much for the trans community, that for friends and family of mine who can be who they are because people who have made strides like you. But my question is, so I'm currently interning with the Federal Aviation Administration, so the plain people.
Yeah.
I don't know anything about aviation, but I'm there. But I am also working on a inclusive language initiative in the industry, but our group are all cisgendered. And how do we go about, you know, making changes that are representative when we don't have the representation that really needs to be there? And could you also talk about what the experience is towards movements like that is recognizing the world is not just a binary, that there is a continuum with gender?
Yes, well, thank you so much for your work. When you say aviation, I thought TSA. Oh, so, whoa, something came out between your legs. I'm like, yeah, it's a penis, honey. It's just a penis, you know. Thank you so much for all your work, and thank you for focusing on this. I think like language is so important, in the way how you navigate it is so important. I would say like one of the most important things is like kind of like talk with some friends on how do you get people that are trans to be in your same position, right? The best way to get people into those into that group is to help them get there, right? So are we supporting somebody to go to school to become part of that group, right? Another thing that you can do in the meanwhile that I'm a huge supporter of is focus groups, right? And let me not say not just focus groups, paid focus groups, right? Because these people are going to be giving you a lot of their experience. So by doing focus groups, like, you know, with the information that you need to support the work that you're doing, I believe that focus groups are really important, right? We opened a clinic for sex workers in New York City called the Coin Clinic, and nobody there was a sex worker. So I said, let's do focus group, and we pay people to come and let us know about it. So I would say like go with focus groups and try to see what it would take to have a trans person become part of that group by being part of there, right? We are not in spaces because I always think like, why isn't a trans woman in an orchestra, right? Just translate it to your group, right? Why isn't a trans woman to an orchestra? I was going to school, I played the French horn, right? So when I started my transition, I had to choose French horn or my identity. And my identity was more important, right? So I couldn't become that amazing French horn player that I could be, right? So kind of look at the roots of why isn't a trans person there, is that do we have trans people that want to have this career and why they don't have it? Do they have opportunities to get education? Do they have opportunities to get these jobs? And when you work into making those changes, you will have very soon a trans person in your group and you won't need to do focus groups or anything else. And in the meanwhile, you keep being the best ally that you can. And I think that because you're here, you are a good ally.
So I am working my way up to be a community activist. I currently just moved to the district and I'm working on gaining residency. But one of the problems that we have in the LGBT community here is a lot of the gays and the lesbians are starting to move up. They're starting to get better positions. But one of the problems that we face in the city is we have a huge problem with specifically transgender homelessness. So I was wondering what your take is on how do we best support those people so that they're getting into housing and that they're improving their lives and kind of following the rest of the community into the, into becoming middle-class people who can afford things and who can, grow in the business community.
Well, first of all, you're not on your way up. You already are an activist because you're doing the work of an activist, right? So it's not such a thing about going up. You are an activist already. You can just, maybe get better jobs in activism, but you're already doing activism. You're doing activism. Yes, make it your business to make a coin with that because, we all need to be paid. So, I'm going to say, I wrote an article for the New York Times that questioned, has the T fallen out from LGBT, right? Because many times that is the question that I ask myself, right? Are we really a community, right? Are my gay and lesbians, I'm not gonna say the bisexual because bisexual gets shit all the time, like but are gays and lesbians really doing the work that they could be doing to support trans people? And most of the time, the answer is no, right? We got gay marriage, marriage equality, that's it. We have nothing else to work for, right? We all can get married. How does that change my life? In any kind of way, right? But I was there fighting for marriage equality. I just want to see my gay and lesbian brothers and sisters be there fighting for trans rights. And most of the time, that's not the case. So most of the times that I have encountered microaggressions come from gays and lesbians, right? That are like, I can ask you about your genitalia, you're my cis, right? And I'm like, no, sis, you can ask me for my genitalia. Yes, you're my cis, but I'll tell you, as you can see, I tell you about my genitalia, but don't ask me, right? Let me volunteer, right? So I would say that it is a lot of room to create allyship within the LGBT community because it's often happen that the LG are really not interested in the T, right? I just got a job with an LGBT organization. It pains me to say it, where the key is to explain to donors why it's important to do trans work. These are people who've been giving money for gay and lesbians, for marriage equality, for surrogate advocacy, but they don't want to give because they feel like the work is too focused on trans people. So my job is let them understand why it's important to keep donating, why we are all a community, why the little umbrella of LGBT still should be an umbrella. So I think it's a lot of work to do to bridge the L and the G with the T. And I think you're doing it, so I'm very happy. And what I'm gonna say is, and thank you for the work that you're doing with homeless folks. I feel like at times advocates and service providers, like I said before, put a lot of their expectations on homeless folks. Homeless folks are gonna be homeless until they decide that they don't wanna be homeless anymore, right? And the work that we do needs to be done without our expectations. Yes, I want to live in a wonderful house, and that may not be the case of other folks. So let's work with people with their time and to respect their desires. Thank you so much for your work. I really love it.
Hello, un placer.
Igualmente, igualmente.
And thank you for, I've been enlightened. This is, this is not normally my space. I think someone here was talking about FAA. I'm also in transportation. I'm an engineer myself. So like public health, like this is like new to me, but I think there's some similarities in transportation. There's some embedded like, discrimination, against various groups, but then there's the issue like trying to bring, change the engineers and hearts and minds and, have them walk in, that experience, walk in their shoes. So whether, in public health or, in my case, in, transportation, like, do you have any recommendations for us as we think about how do we bring, whether it's the public or decision makers to walk in on, in the community's shoes to, move the needle for the best of all?
Well, thank you. Thank you for all that work and thank you for the interest in doing this. I think like these kind of spaces are transformative, right? And I talk a lot of shit and things like that, but I really hope that you all leave this space with something that spark your interest in creating that change that we're looking for, though. And I believe that, because you just asked that question, you are going to leave this space trying to get something to change in the spaces that you work at. I would say the same thing that I said to this person. They are meet with people in your area of work and look at why isn't it a trans person doing this work with us? Can we create a fund for a trans person that wants to go to school to become an engineer, right? Can we raise money to pay for the school of a trans person that wants to be an engineer? Because then if you don't create those spaces, we don't have those kind of opportunities. So the best way to have trans engineers is to pay for the school. The best way to make sure that trans engineers have a quality of life at work is to make the changes that they need for their jobs, right? When they have a job. So get that trans engineer to be an engineer first, and then when they get to work, think about, do we have bathrooms that are accessible for them? Do we have a health insurance that pays for the boobs? I'm still obsessed with boobs. Or whatever surgery, right? Do we have an email system that respect the names of these folks, even if they didn't change it? Do we talk about gender pronouns? Do we talk about the needs of the community? So I would say first focus on how to get a trans engineer to work with you. When you get one, make sure that they have the same quality of work that you do. And then you got it. Bye-bye.
Thank you so much for coming out. First of all, I was so enlightened by all of your words this evening. So my name is AJ King, and I am the Assistant Director of the Multicultural Student Service Center, GW, and over at LGBTQ Resource Center. And on one of my side projects, I work with LGBTQ youth.
I thought you would say one of my side pieces. I'm like, ooh.
Okay. One of my side projects, I work with LGBTQ youth in theater and tell their stories. And something that I have encountered on actually about 3 or 4 occasions is I've had some young people who were also undocumented as well. And they were all trans youth. And almost all of them have said, they wanted to be doctors, or they wanted to go into business, or they wanted to go into politics. But because they were undocumented, because they were trans identified, because they were people of color, their communities have said, kind of like what you mentioned earlier, all you can do is sex work, and that's all the only way to be successful, right? And so I want to be able to advocate and support them and say, if you want to do sex work, by all means, do your thing, here's prevention and safety measures, do your thing, right? But that's not your only option. You can also do those other things you want, but the community of other trans folk of color, particularly undocumented, are saying this is all you can do. And that's who particularly is surrounding around them. So I'm wondering, I would love some advice from you of how I can, as a cisgender person who has a level of privilege around that, can also support them and say you have options as well too, with all of their like-minded people who have lived experiences that are saying, no, your only option is this.
I don't think you need much help. I know you're good at it. I know you're good at it, just for the way on how you phrase the question. This is what I'm gonna say, many cis white women, maybe some of them in this space, pay for the university dancing or seeing clients, so people can do both, right? If that's what they want, it's always a good way to make it happen. But what I want to focus mostly is when you mention about storytelling, right? Finding empowerment through storytelling is so incredible, right? So I think that is the secret in your work, kind of helping folks through telling their stories, to finding empowerment through it, and they're going to understand themselves that they can do these things that they want to be doctors or be architects or be whatever they want, by finding empowerment through storytelling. That's what I do. I just wrote a book. I can't fucking believe it. I have a book. It's gonna be a book out there with my name. And all of that book started with a storytelling event where I told the story about the UFO, right? And that was the first story that I ever told. And here I am telling the same story at George Washington University, right? So the kind of empowerment that comes from owning your story, from telling it to others, and from being proud of it is what really is gonna get those folks to get those positions and those careers that you're talking about.
I'm just wanted to ask your advice as someone who's a cisgender person looking into going to counseling for LGBTQ and psychological services. What would you suggest would be the best way to go about bridging the gap for trans people?
Yeah, thank you for that, and thank you also for just going where you're going. We really need mental health providers and counselors that do this work. As I said, my first counselor was a trans woman, and I would not be here if it wasn't for her, right? Having somebody that really understands. In my case, I had the pleasure to have a trans woman, but I had a therapist that was a cis woman. We just broke up after 10 years. It was amicable. I still love her, but I'm like, 10 years is okay, mama. Let me go on my own. But she was the least judgmental person that I ever met. I am not saying that she didn't have judgments of me. I'm saying she didn't show it, right? And that made a huge difference. And I'm gonna go again to something that I said before. I don't know your upbringing, right? But because you mentioned that you are a cisgender person, I'm gonna understand that you grew up with that privilege of your gender not being questioned, right? some things that medical providers do, and I already mentioned this, and I'm gonna mention it again. We project our experience and our history to our clients, right? The experience of a trans person that comes looking for counseling to you is gonna have nothing to do with yours. So the best thing that you can do is, as you help her, help them, whoever they are, you're gonna get an opportunity to listen to them and not to translate your experience into what they need or want. So I feel terrible giving advice. I was like, oh, I give advice. Thank you, these shoes were killing me.
Oh man, I can't say how much I appreciate your coming, Cecilia. I just told her run for office because she's got it all, and she's got it. Seriously, en serio. Thank you very much for coming. I'm going to take a moment here to point out the fact that this is indeed a fundraiser for our program. And I really want to thank those of you who made a little contribution before you came. And I'm also going to ask those of you who are here that haven't to find these little pledge cards that are sort of hanging around with our volunteers who will be walking around with them shortly to perhaps make a contribution. I want to point to some of the alumni in our office, or excuse me, in our space. Adam, do you have the microphone? You do. Come on up. I want to introduce you to a few alumni. And some pledge cards will be coming around, but Adam is an alumnus of the program from 2015, year 2, and we have some other alumni here, but I want them to tell you a little bit about like how important our program is and why.
Absolutely, thank you, Steve. So yeah, as Steve mentioned, I was a student way back in the second cohort of the program, a long time ago. But I was supported by a scholarship in the program. And Cecilia spoke a lot about opportunity. And so the donations, if you're able to make a donation today, they really do go to provide opportunity for students. So through my experiences in the LGBT health program, I actually decided I got interested in population health and decided to pursue a PhD here at GW in epidemiology, which I'm now finishing. And I now work as the program manager and statistician for an international group of scientists pursuing a cure for HIV. So it's very meaningful work. I love it, and the program here really, I mean, it hooked me on GW, and it provided me the opportunity to continue pursuing my own education. So if you're able to help support students, your funds go to help support scholarships for students like myself. Please donate if you're able to. And I don't know if Max or Ron want to come up and speak for a minute. This is totally off the cuff. They weren't expecting it.
No expecting at all. Yeah, no, I just echo everything. I was in the first cohort, and I have a very sort of different story than probably most because I was definitely, a later career student. I was already at work at the American Psychological Association in what was then called the Office on Sexual Orientation at Duke University. And what the program gave me was coming to that work, not a psychologist. My background was undergrad sociology and broadcast journalism. And so to work with psychologists and not understand their work, as well as the program helped me to understand their work, contributed greatly to my ability to move my work forward, even though I'm still in the same place, okay? And the other thing I'll say is on those forms, there's probably a box you could check that says make this a monthly contribution. I've been getting $30 a month for years.
I'll just say, please give support this
Awesome.
program. It's amazing. It is, you know, helping all of us to further this type of work, and exactly what Cecilia was talking about. I mean, it's hard as a white cis gay man to say these things, but it's great to hear your story, your encouragement, and you know, we're letting us know that even the work that we're doing, it does make a difference. And Ron and I were just saying earlier, it is so beyond time. You were right. We were talking about the elementary, and I said it is so beyond time for us to stand up for our trans brothers and sisters and non-binary. It's time to move this on, and I think we're being presented with it. Unfortunately, you know, it's the controversial, it's the conservative, what's happening in Texas, ignorant, what's happening in Texas and Florida, but it's going to drive the conversation. It's going to move this forward.
We mean like made it women of politics now, and that, you know, it's so sad that my life and my experience has become the focus of like so much hate speech that fuels so much hate, and I just want to live my life, you know. I just want to, you know, get it all in the house. Tomatoes.
Yeah. And I don't need a microphone, but those who don't know me, I kept therapy. You usually can hear me pretty well. I want to point out that the only reason that we have a trans scholarship in our program is because an alumni of GW donated funds to allow us in the program to have a trans scholarship. So if that's something that concerns you, if policy work concerns you, if any part of the LGBTQ MOUSC rainbow concerns you, you can dedicate your donation to the program specifically for those causes.
Yeah. Yeah, a shout out to April Lewis is the donor. April Lewis was a freshman in my in 2016, my general psychology class, transitioned just a couple of years ago and is now upped her donation to 2 scholarships for students who are proposing capstones on transition related care for trans people. I gotta thank everybody here, Cecilia, muchas gracias, for Joe Kennedy and for Provost Bracey for being here tonight. Thank you for coming. And Andrew, oh my God. I know.
I'm here. So.
The miracle workers. So I appreciate your coming. Please grab one of these things, fill it out, give us whatever you can, and thank you very much for coming. We can hang out for a little bit. We've got a few minutes before you have to clear out, but thank you very much for coming. Good night.
So awesome. Go for one world so that I can get a group photo of everyone. Would that be okay? Yeah. I would love that. This is one side. I would love that.
Picture in the front. Right over here. Okay.
Yeah, right. Am I tall enough? You guys are taller. You gotta get heels. Yeah, well, I just Is it presumptuous that I come here? No, not at all. Not at all presumptuous.
I think Cecilia should be in the middle, no?
Oh, yeah, for sure. Very, very smart.
Gentleman right here, you're the end of what I can see. Okay, so I can see you're my dog in the red, dog in the red.
Get in here. Get in here. sure she will. Gotcha. All right, Ben.